Evening. Well, just a few days ago, Dr. Imtiaz Sooliman, at Gift of the Givers, described the situation in the Eastern Cape as a war zone. In July, he mentioned that he had seen children having to eat wild plants. Hunger, malnutrition and drought in that province have worsened in part due to the COVID-19 pandemic and the lockdown. Well, Dr. Sooliman joins us now, along with the researcher, Dr. Xolisile Ngumbela from Fort Hare University. Right, let's start with you, Dr. Sooliman, the founder of Gift of the Givers. How bad is the situation in the Eastern Cape at this moment?
Hi, good evening, Stephen. It's probably the worst we've ever seen in the history of Gift of the Givers. We have a 28-year history. We've been to many parts of the country, but since the lockdown, we've never seen such hunger in the entire country like we have seen in the Eastern Cape. And we've measured that by being physically on the ground, and also the amount of calls we get to our call center, the messages we get on our social media, the personal calls our people receive, and the emails we receive. At one point, we were getting like 8,000 emails at any one point in our inbox, and it's coming predominantly from the Eastern Cape. When we went onto the ground, we saw for ourselves, yes, we couldn't see malnutrition because that's a clinical diagnosis. And of course, patients were not coming to the hospital. They were not coming for conditions other than COVID-19. So that's something we could not measure. But just from the voices of the people and the reaction you had when you brought your food parcels, for instance, when the teams are waiting with the people and they see the truck coming up the hill, they break into song and dance, clapping, ululating, praising God Almighty, food coming in. You mentioned introduction about eating plants. In a place called Paddy, after we gave the food parcel to a mother, she tells us, please talk to my children. They will tell you the taste of every plant in this area. They have been eating the plants in this area for several months now. We said, did you notice we had any food here? They said we hundreds of people in this community. We received 10 food parcels. Who's going to eat and who's going to look? Soon after that, we started getting messages of people eating grass, of children being fed grass just to survive. And a few weeks ago, from a place near outside Mamtata, we got a call from a lady to say she has to move the cats and dogs away from the streets because people are eating the cats and the dogs. She says she's not implicating people, but she's saying it's desperation. A week after that, from a place called Mount Coke and in Willowmore, we got messages, please can you help? People are eating the tortoises. And this, further to that, when we went to dumping sites, we see the children waiting for the dump trucks to come. The moment the trucks come, they run to see what they can scavenge. We saw them eating jam from a serrated tin, both dangerous in terms of cutting and infection, and also from peanut butter bottles and anything they could find. But everywhere you go, we are hungry. Our children are hungry. We haven't eaten for days, for weeks. What must we do? Please help us. Nobody listens to us. Nobody comes. I mean, I can go on and on.
Sure. Dr. Ngumbela, I mean, is the situation we're seeing in the Eastern Cape, has it got particular features that make it different to what's happening in the rest of the country?
Not at all, Stephen. Good evening to you and your viewers at home. First of all, Stephen, I must say I do agree with the previous speaker. And the situation in the Eastern Cape is really getting out of hand. And the situation, Stephen, it's not only starting now. It has long been there. And when we acquired democracy, and I think the RDP, one of its fundamental views was to address the question of poverty. Given, Stephen, that even our own constitution, the Bill of Rights, when you look into Section 10, you talk about the human dignity, as well as Section 27, especially C, as well as Section 10, where you talk about the kids. The situation is worse. And even when you go, especially around the Inuza Hill, apart from the areas that Dr. Sooliman has mentioned, you will find out there is an excessive acute malnutrition. And prior the COVID-19, what we were told by communities and even the health professionals, they would tell you that they were in herbal intoxication, of which it was a lot of nonsense. It was actually food insecurity, poverty at its best. and also the incessant drought that has contributed into the situation. And you'll find out the situation, even the school nutrition, the parents would tell you, how are we going to look for the young one getting food whilst we are hungry ourselves? And the situation, Stephen, it's as if it's a war zone. And this COVID-19, what has given and attributed to the communities is that the governments and the communities were not ready in terms of a disaster management. And the way forward is getting difficult. And looking into the question of the food parcels, I found they are unsustainable, and it's hit and run. And this food insecurity, poverty situation doesn't necessarily need government alone. It is a matter of conglomerate actors. You talk of your big businesses, you talk of your civil society, government, and also the communities themselves, and all the strategies that are there, that have been there. You will find out the communities are left behind. They are not at the center, and they are not the main actors of their own destiny. And this situation, Stephen, calls for all heads on the deck. But what is surprising and disappointing is that the have-nots of this country, they keep stealing to the have-nots. And yet, we all know that when we were struggling for a better South Africa. But now the issues are not like that, and the communities are left to die out of hunger.
Dr. Sooliman, I mean, surely you would think that government is aware of this, and government in the Eastern Cape as well, that they would be doing something?
Stephen, I really doubt that. I find it very, it'll be strange to say the government doesn't know about that. But quite often when you speak to them, people say nobody has come to them. They haven't received vouchers, they haven't received food parcels. When you speak to government officers, it's like you're telling them a fairy tale. They can't believe that such a thing is happening. And I've had that experience not only in the Eastern Cape. You find advisors tell premiers or people in top positions what they want to hear, what is not exactly the situation on the ground. And the biggest downfall is they don't go out themselves to have a look. They need to go themselves to the area because their subjects need to be seen, and they need to see their subjects and see what the situation is. So I don't think they know exactly what's going on in the ground. If they did and they didn't respond, it's criminal. If they didn't know, it's ignorance, and it's dereliction of duty. They should be going on the ground and seeing people, like when you get to the people and say, nobody came. Nobody brought food parcels. And then those who are there, they don't listen. We don't get any feedback. Our voices are not heard. It's not worth trying anymore. We're wasting our time. We're making no progress. It's all those kind of answers that you get. So the first thing they need to do is get out of the office, get out of the smart car, and go to the field. And the rural areas especially, those are the areas that are forgotten. Everybody likes to go to the metros. It's very easy. It's where all the cameras are. It can be done quickly, no difficulty. Within 20 minutes, you're back in this nice, comfortable place. It's not like that in the rural areas. Your truck breaks down. The weather is funny. You have difficulty going outside. Thousands of people you have to talk to. It's a long, long process. The other thing that we missed out, and I agree with Dr. Ngumbela, that this thing didn't start now. It started 3 to 4 years ago when the drought hit earlier in 2015. And it's really, really bad. Stephen, I like to tell you frankly, right, and you'll understand that. You're an Afrikaner. Afrikaner people don't put their hand out. It's pride. You say, look, it's not pride in a negative concept. Pride about managing on your own. When an Afrikaner farmer says, please bring food parcels for my farm worker, but can you also bring me a food parcel? I need to feed my family. The situation is absolutely critical because you have to go beyond asking for the farm workers and say honestly, but I also need one. And the fact that they ask you means they trust you. And that's what you're seeing in the area. That's how I measured how bad the situation is.
Dr. Sooliman, we're about to run out of time. Dr. Ngumbela, I would like to just ask you, we need obviously a short-term solution. We need to get food into people's stomachs, and we need to do that now. We need long-term solutions as well.
Stephen, first of all, food insecurity, it's a long-term situation, and it needs a long-term, and it is a multifaceted issue, and it needs a multi-pronged approach, and it needs a proper planning and a proper execution of the situation. And for now, to come and say the government it would be disingenuous of them to say they don't know and they don't understand how catastrophic is the situation. What we need, Stephen, as this country, is to appropriately implement the rural development strategy. And I agree with Dr. Sooliman to say these civil society organizations that are assisting with these food parcels that are not sustainable. For instance, in the Eastern Cape, take Amatole, for instance, those civil society organizations are only concentrated in the Buffalo City, in East London. They don't go to the rural areas. That's where the problem is. Let's go back to agriculture. Let's go back to the land. And Stephen, at times when the people, especially in the parliament and legislatures, are talking about land, you get so surprised. For whose benefit? For what purpose? So you end up not knowing. If we can partner with the communities and come up with the sustainable strategies that are futuristic, that we are able to execute with them. And as we know that the theories that are there, everybody would sing the theory that we need to partner with the communities. We need the communities. And the theory of change that we're talking about, we must see the impact. Unfortunately, all the strategies that this government has been implementing are not yielding any positive results because they have left at the center the downtrodden communities that are part and parcel of this community. And also, this government must provide each and every community with the agricultural experts, if you get what I mean, so that they can partner and analyze the soil type and what is it that they can benefit. But now, Stephen, even during the homeland system, we had Vukuzenzele, we had such initiatives where the communities were partnering, and even this nutrition that we're talking about at the schools, you will find out the very same vegetables and the nutritious foods is not even bought from the SMMEs, that is to capacitate them and to keep the rand flowing within the community. You'll find out we are buying from the big chain stores, and they are transporting this food. And what happens to the food when it's in transit? Is it nutritious enough? And look at the rate. There is a paper that I published talking to the acute malnutrition deaths in the health facilities because of this malnutrition, especially around the Imuza Hill. You'll find out, Stephen, we are not serious about food security, and we're not serious about our communities. Even the food parcels that were meant for the community, they ended up in councillors and their friends' houses. And
Dr.
yet
Ngumbela, I'm so sorry, so we are going to have to leave it there. Dr. Xolisile Ngumbela, researcher at the University of Fort Hare, and Dr. Imtiaz Sooliman, the founder of Gift of the Givers, thank you both very much indeed.